Okay. Hi everyone, this is Tej. This is my mentor, Mrs. Heaney, and we're here at Carrington College, California in San Jose. And I just wanted to say I've had a great experience. I've learned a lot. It's nice to be on the other end and just really see how things are run in the background and what it really takes to get things going. And I really enjoyed it, and it made me gave me a better inclination of wanting to do clinical teaching. So I'll go ahead and begin interviewing Mrs. Heaney. So, ready, Mrs. Heaney?
I am.
Okay. So first question I have for you is, why did you end up choosing dental hygiene as a career?
That's a really good question, because at the time that I was nearing graduation from high school, I was really thinking about going into nursing, and I was really torn, so I actually just started enrolling in all the same classes because they're very similar prereqs. So anatomy, physiology, microbiology, chemistry 30A and B, and along the way I actually became friends with two students that were going into dental hygiene. And so over this summer I had a chance to work at a convalescent home and then in a dental office, and I found that I really liked the dental office setting better. It just suited my personality. I think I was concerned that with nursing I would have a really hard time leaving my emotions at the door, because several of my patients passed away that summer in the convalescent hospital, and I just didn't think it was going to be the right fit. I was a young enough woman that I didn't have the life skills. However, I found that hygiene, I still had the same intimate or personal relationships, but I wasn't dealing with the severe health issues on such an overwhelming basis. So hygiene just seemed to be a perfect fit for me.
It suits you really well.
Thank you.
Okay. Actually, I wanted to do nursing first as well, and then I switched over.
Yeah, they're both great professions, but
Yeah.
I think it's a calling, and that's how you'll know where your fit
and
really
I love to talk
is.
a lot, so it works.
Yeah.
So, okay. So, it says, why and when did you decide to become a dental hygiene director, which is your current position?
Okay, well, that was kind of a journey. I worked in private practice for 16 years, and then I actually had an opportunity. I ran into my former director from when I was a student, and she invited me up to the school to address her graduating class and talk about the real world and what it was like. And I found I really loved it. I had not been back in the academic setting for a long time. At that time, I never contemplated that I would ever end up in a director's role, but I decided I did want to return to teach. And interestingly enough, when I was recruited to start the Carrington College Dental Hygiene program, I had spent 2 years at University of the Pacific developing a baccalaureate program. And at the time, my director had asked me if I'd be interested in maybe assuming a directorship in the future. And I said, no, I'm really very happy with teaching. So I was recruited to come to Carrington, and within 6 months I was asked by the administrators here to assume the director's position. So I did so a little reluctantly, only because my true love is clinical instruction. But how I've managed to balance that is I still am preclinical, clinical instructor, and I still get to teach in the classroom. And with the administrative duties, they actually challenged me in different ways, working with a very diverse employee population, working with a very diverse student population. I've grown some skills that have actually helped me to be a better educator in and out of the classroom.
Okay, good. And so, since you've had experience in both private practice and teaching, what would you say the main differences are?
I think probably the biggest difference is that when you're in private practice, you're working with your patients one-on-one, and you're educating them on an individual basis. You're looking at their needs, and you're trying to create a treatment plan and then treat them with respect as far as cultural differences and differences in abilities to maybe perform certain functions. So you get to really be good at reading how best to help each other, and as far as patient care. And then when you're in the clinical instructor role, you have an opportunity to take what you've learned in private practice and apply that to a larger group of individuals. So I love it because it's education. It's just education with a larger patient pool.
Right, on a bigger scale.
Yeah.
Right. Okay. And Is there a certain patient or a time or experience that you've had that you'll never forget, and why?
Yes, I had a patient that I treated for many years in private practice. I treated her and her husband, and she came in to my operatory one day, and she said that she had recently been diagnosed with a melanoma. And so we cried together. It was pretty end stage. And her whole dream was that she wanted to go on a cruise.
Mm-hmm.
So they booked the cruise, and they went on the cruise, and she passed away shortly after that.
Oh,
And I
wow.
can still remember exactly what she looked like the day that we spent together crying, because she was very young. She was expecting her first grandchild. She had her whole life
Oh, wow.
ahead of
Yeah.
her. And when you start to lose patients and family in your life, you realize every moment counts.
Definitely, yeah.
And we really need to, make every moment precious.
Right. Okay. And so what do you find to be the most rewarding part of your job?
The most rewarding is I love to create things. So I love to create new ways of teaching, new ways of thinking outside the box to help students. So some of the things that we've created recently is that when students are with patients, it's really hard sometimes to correct their skills because you don't want the student to lose self-esteem.
Right.
So I really spent some time brainstorming, and we came up with a skills day where we set up type-it-ons, and there's no grading attached.
Mhm.
It's all feedback. So you can look at a student's skills on a type-it-on, and you can start to make suggestions and make corrections, and the student's not embarrassed to ask questions. And to me, it was really joyous to see that many of the skills they'd mastered, they took a lot of pride in, but they could also embrace adding a few more things without feeling bad or feeling like they missed something, because you're one-on-one.
Right.
So I enjoy that both with my students and then with my faculty, really creating calibration exercises that are meaningful, helping them to remember what it's like to be a student in the student role, because sometimes instructors forget in the haste and hurry of clinical instruction. If you don't deliver a message well, students won't hear your message.
Right.
Instead, they'll just go away and they'll feel really badly about the whole
Exactly. It
experience.
builds up,
Yeah.
Okay, good. And so as far as dental hygiene, in California, what changes do you see happening in the near future? Or what do you hope to see at least?
Okay, this is an exciting time because we are the first state in the nation that has actually their own Dental Hygiene Committee of California, so we're autonomous, and that's an exciting time. And actually on the horizon, and I just saw the regulations, in California, dental hygiene educational programs are going to be regulated by the state of California, the Dental Hygiene Committee of
wow.
California. This is very monumental. It's very historical. We're all accredited under CODA. But as far as regulations, they're really looking at a minimum standard for how many hours. They're also looking at what type of injection students should be giving, enrichment, making sure that all programs have a cultural diversity course. So I'm excited about it because I think what they're looking at in the future is a mid-level practitioner. So making sure that all the programs are standardized, that students are actually inspired to go on to get higher degrees, and setting that in place both in the academic setting and the professional world, is that we have a lot of room to grow as clinicians and therapists, and I think California is going to be on the leading edge of that change.
It's exciting.
It is.
And so last question. What would you say is the most challenging part, with working with so many different education styles?
Okay, I think the hardest part when you come back, especially in the director's role, and I'm a teacher and I'm a director, is that most of us, when we come back to teach, we tend to teach in our comfort zone. That means we like to teach the same way that we were taught. However, that's not the most effective way to instruct. There are so many different learning styles. I'd say there's a large percentage of the student population that are visual learners, but when people are drawn to dental hygiene, they're also kinesthetic learners. They need to touch things, they need to see it dimensionally. So I think the biggest challenge is helping others to see that lectures should be very short, 15 to 20 minutes, and then do an activity and turn the learning back over to the adult students that are the learners,
Right.
because they are adults and they're responsible for their own learning. Moving away from sage on the stage to being a facilitator. And most of us, when we have to move out of our comfort zone, we don't like it.
Mm-mm, not at all.
So instead, what you need, what I'm trying to get them to do is go into other classrooms, see how different instructors bring the learning to life by maybe using YouTube videos or using audience response systems or using case scenarios or having students do the research and present to their classmates, because that's active learning.
Right. Okay. Anything else that you like to say, or?
Only that it's been really a pleasure to have Tej back. I'm really hoping that maybe you will continue your career into the clinical and didactic instruction arena. You're a natural. Students really like working with you, and your faculty are really honored to have you back.
Oh, thank you. So that was it.
Yay, did we make it?